Okay. Well, good afternoon, everyone. Thank you so much for being here for the HIV/AIDS Unity Day press conference addressing the Ohio HIV Drug Assistance Program. My name is Judith Pindell. I'm the Director of Public Policy and Advocacy at the AIDS Task Force of Greater Cleveland. We have several people who we've been speaking with for several weeks who would have loved to have joined us today, and so I would like to acknowledge those who aren't able to make it because of their schedules. Representative Denise Driehaus, Representative Michael Cinziano, Senator Shirley Smith, Senator Michael Skindle, and Senator Nina Turner. At this time, I would like to bring to the podium Representative David Burke.
Thank you for that introduction, and thank you for having us here today on what really is an important program that I think is often overlooked in a disease state that we don't talk about too much anymore, and that's HIV/AIDS. And of course, what used to be a killer condition has now become a chronic condition. And funding these medications through the Ryan White Task Force and other kinds of entities that we use helps our state. It not only helps other individuals remain healthy, but allows them to be productive, keep them off Medicaid, supplements that group that maybe doesn't quite have a federal poverty level that qualifies for assistance, but yet their insurance doesn't quite cover all their medication costs. And as we deal with this chronic disease state and allow people to be participants in Ohio as taxpayers, as moms, as dads, as children grow up, certainly this program adds value to our state, and I'm happy that we could add value to it in the budget. I wish we could have done a lot more, but it's a good start, and hopefully through Senate and Conference Committee, we'll build on what the House has started. Thank you.
Thank you, Representative. I'd like to bring to the podium Nickie Antonio.
Thank you. Hi, I'm State Representative Nickie Antonio, and I represent the 13th House District. Prior to my coming to the House, I worked in the Ryan White program, also ran a women's center years ago, back in 1995, when we were first talking about ADAP programs and syringe exchange and how to serve folks who were becoming HIV positive. And so we've come a long way, and at the same time, we still have a long way to go. As Representative Burke mentioned, and I thank the representative so much for his championing the budget for the HIV/AIDS support, because that really makes an incredible difference for so many people who are living with HIV and AIDS. We need to keep the promise. We need to continue to make sure that we are caring for and have the services and the medications available and the funding for people who are living with HIV and AIDS. Because when you keep folks in care, they stay healthier for a longer period of time. Their quality of life improves. And because the theme of today is unity, I love the word, because you and I are both in the word unity. And it takes you and I to make sure that people not only get into care when they find out that they're HIV positive, but that they stay in care. Because as their health improves, so does the health of our communities. And that's really the most important thing. We made a promise. We make a promise. The promise is to care for people, to keep people in care. And we need to make sure that that's a part of our priority as legislators as we go forward. And so I thank you for being here today. I thank all of the list of legislators that are either behind me or are behind all of us, with all of us, because it takes all of us to fight and to make sure that the funding stays as it should. Right now, we have 413 people on a waiting list just to get their medications. That's not acceptable. In order for them to stay healthy, we need to get them into care. Thank you so much for being here, and I'm in here for the long run with the fight. We'll talk a little bit later about some other legislation that Representative Foley and I are working on to make sure that we can keep folks who are IV drug users healthy with an exchange program. We'll talk about that a little later. Thanks so much for being here.
Nickie, I'd like to ask you to stay up here while we bring Representative Foley, wherever, there you are right in front of me, to speak a little bit about a piece of legislation that he will be introducing tomorrow around syringe exchange and HIV and hepatitis C prevention.
Okay. I was hiding right in front of you.
Yes.
Thank you, and I want to thank the organizers for the press rally today and getting folks out. Representative Antonio and I are introducing for sponsor legislation tomorrow House Bill 182, which is a needle exchange program for the state of Ohio. Currently in the state of Ohio, in order for a municipality or a township or any local jurisdiction to engage in a needle exchange program, there has to be a political decision made by the local mayor and city council that there's a public health emergency. We think that there's public health emergencies around HIV and intravenous drug use and the bloodborne diseases that are consequent to that due to needle exchanges all throughout the state. However, this is, as a political decision, it's hard sometimes for mayors and city council people to make that decision saying that there's a need for needle exchange programs. Needle exchange programs are just that. They are a program set aside to exchange dirty needles for clean needles. They reduce the instance of diseases due to intravenous drug use by what the Government Accountability Office has indicated is about 33%, by a third of the diseases that are transferred are diminished because of clean needle exchange programs. Clean needle exchange programs exist all over the world. They exist all over the United States. We, right now in the state of Ohio, have two places in the state of Ohio, Portsmouth, Ohio, and Cleveland, Ohio, that have needle exchange programs. In the city of Cleveland, it's been going on for 10 years, and it's been, while it started off controversial, it's been highly successful. Highly successful. And it's both been successful in doing needle exchanges, diminishing the amount of diseases, but also getting people off of drugs and getting people health care that they need. So we want to make it easier for health departments in counties across the state to make those medical decisions, healthcare related decisions about whether a clean needle exchange program needs to exist in their community. And our legislation that we're bringing forward tomorrow, we think will do that. So again, I want to thank the organizers today, the Unity Day groups that are here today, and I'm sure we'll take any questions that you have at the end.
Thank you, Representatives. Again, I'd like to thank all of the representatives and legislators here today who have been tireless supporters for the HIV/AIDS community. At this time, I'd like to introduce Tracy Jones, who is the Executive Director of the AIDS Task Force of Greater Cleveland.
Good evening, and it is evening. Good afternoon. We're delighted to be here today. As Judith said, my name is Tracy Jones. I'm an Executive Director for the AIDS Task Force of Greater Cleveland, and I'm here today representing my colleagues from the AIDS service organizations from across Ohio, namely Kevin Sullivan, Executive Director of the Ohio AIDS Coalition, Bill Hardy, Executive Director of AIDS Resource Center Ohio, Peggy Anderson, Executive Director of the Columbus AIDS Task Force, and Linda Setter, Executive Director of CARICO. As we've heard, the Ohio HIV Drug Assistance Program is good. It's an effective program that works, and it provides assistance in life-giving medications and critical services to Ohioans who cannot afford them. As with all nonprofit services in Ohio, the AIDS Task Force of Greater Cleveland is experiencing increased need for care and services during a time of drastic decreases in resources. Current and proposed funding levels for Ohio Drug Assistance Program fall dangerously short of adequately sustaining the needs of each and every Ohioan in this program. We know that early HIV antiviral treatment can help significantly reduce transmission, keeping individuals healthier and ultimately extending their health and life and productivity. As all of this talk of budget items and cost-cutting containment and waiting lists, we must remember that a person, a mother, a brother, child, and friend, a neighbor, wanting no more than an opportunity to have a healthy and productive life is our goal. This is recognized most apparently in the service that we provide at the AIDS Task Force to young people. There's a young person currently now who has been living with HIV all of his life, and it's currently in the system of care, which we call criminal justice. Unfortunately, even though he's receiving services under that system, it is a struggle to make sure that he gets the life-giving medications that he deserves and he needs to keep safe and healthy until he can rectify his situation as it relates to criminal justice. This is the situation for this individual and for a number of individuals across the nation who are young and experiencing challenges. But if we can keep them medicated, we know that we can extend their lives until we can correct situations that might be troubling for them. As was mentioned earlier, we've got 413 individuals who are currently on the waiting list, and each of them have their own personal stories and struggles and triumphs. The impact of their loved ones and in our community is evidenced in the pill bottles that you see in front of you. Each one of these is an individual, and each one of these pill bottles is filled with a message from citizens who care about their fellow Ohioans. Today we will deliver these pills and messages to the governor and legislators, reminding them to keep the promise to Ohio, families, communities, and all of us who are impacted by HIV and AIDS. It's the logical and the right thing to do. Please keep the promise. Thank you.
Thank you, Ms. Jones. Now I would like to introduce our featured speaker, Elaine Henderson.
Hello, my name is Elaine Henderson, and I've been diagnosed HIV positive since April of 2008. 30 years ago, I was 10 years old and in the 4th grade. Gas was $1.25 a gallon. Eggs were 99 cents a dozen. Dreamgirls opened on Broadway. Pope John Paul II was shot and wounded by an assailant in St. Peter's Square. Sandra Day O'Connor became the first female Supreme Court Justice. The Oakland Raiders beat the Philadelphia Eagles 27-10 in Super Bowl 15. Bob Marley, king of reggae, dies of lung cancer at age 36. 9 small earthquakes were recorded in Western Ohio by the University of Michigan Seismological Observatory. And the first recognized cases of AIDS appeared among gay men in New York and California. Today we gather HIV positive and negative, men and women who are gay, straight, bisexual, and transgender. We are black, white, red, and brown. We are young and old, and we are from various religious backgrounds. We're united. We know that HIV/AIDS does not discriminate. It does not know color, age, sexual orientation, or care about what part of the state you live in. Currently, there are 413 individuals living with HIV on Ohio's Drug Assistance Program's wait list, including myself. It's a scary thing wondering month to month whether the medications you need to save your life are going to be available. Advocating and rallying, hoping that your legislators understand just how important this issue really is. 30 years ago, people prayed for life-saving medication and they watched as friends and loved ones died from AIDS at alarming rates. Today we have the medication, but we pray for access to them before we become too frail, before we become too sick, and before it's too late. Thank you for coming together. And united, we can and will make a difference.
This concludes our press conference. Thank you so much for joining us, and I would like to thank again all of our legislators who have joined us today. Thank you. Questions? Do we have any questions? Yes.
To better perspective, there are 413 on the waiting list. How many people actually are allowed the drugs through the program so far?
He wants to know what the total is. So if there's 413 what's the total number? In Northeast Ohio?
In Ohio.
Across Ohio, I would say that it's probably somewhere near 10,000. Forgive me for not having that exact number. In our last resolution. Thank you very much. Sorry.
That's okay.
Regional thoughts. Tell you about Cleveland.